picture of my mom, my sister, and me. My mom and I have always been best friends. I'm the kid that called her 3 times a day to tell her everything. In April of 2014, just a few days after my mom's 58th birthday, she was diagnosed with an aggressive form of throat cancer. This was devastating news for my whole family, for my mom and my dad, my sisters, and me. The kind of thing that makes you feel like your world has completely stopped spinning. When I got the call with that news, all I remember is falling to the floor in shock. Sure, her prognosis at the time was not hopeless. She had treatment options available that included chemotherapy in conjunction with radiation and radical surgery. And she had excellent health insurance. Still, in the face of a disease like this, we needed more. Since my go-to is research, I dug in. I have a PhD, I study health policy, and how policy can be used to improve community well-being. But none of these things made me immune from facing this challenge. I had assumed that I was an expert, that my experience prepared me to help my mom navigate the healthcare system and the social safety net in place for families like ours in times of crisis. But I was wrong. I had to learn a lot in a short amount of time about throat cancer and treatment, physician referrals, insurance appeals, Social Security disability, family and sick leave policy, and so much more. And all of this propelled me to think about how I could be helpful to my family in new ways that have ultimately changed my approach to problem solving in both my personal and professional life. Now, inevitably, individuals and communities alike face barriers that seem insurmountable, barriers that keep us from living happy, healthy lives. These things include poverty, sickness and disease, loneliness, crime, and they can feel so big and intractable that it's hard to know how to help, what to do, or if you should even try. Our society has established ways of addressing these barriers, common approaches to problem solving, which we'll call the status quo. However, the status quo has some critical things that just aren't working for us. First, assuming that we're experts. Now, I'm an academic, and we're really good at assuming we know everything, okay? But we all do this to some extent, right? Assuming that we know more than we actually do, and we do this especially regarding the place that we live. Second, working in isolation. Individuals and agencies all too often choose to work alone, resulting in things like duplication of services and unnecessary reinventing of the wheel. And third, focusing on emergencies only. The usual focus is on acute need, things like emergency hunger. Physicians would call this a palliative approach, one where we try to manage the very worst symptoms of a disease without actually trying to treat the root cause. Now, I love teaching. It's a huge part of my job. And as a professor of health policy, I challenge my students with coming up with policy solutions to common problems. And I often see them revert to the status quo. Time and time again, my students want to invent new nonprofits, organizations, policies, infrastructure, assuming that because a problem exists, that surely nothing is being done about it, and feeling as if they have to start from scratch. Now, I've got some students in the audience tonight, so I'm telling on y'all. But this is where I have to say to them, we do not live in the wilderness. I am not dropping you off in a jungle naked with a toothpick and some duct tape and telling you to fix a complex problem. We live in a city with over 100,000 people, with hospitals and nonprofits and a really robust social service safety net. So let's focus on that and think about how we can build on it. Now, both in and out of the classroom, we all make these same mistakes, and they are stopping us from making real, lasting progress. But it does not have to be this way. We can take a different path by taking a strengths-based approach to community problem solving. We can move beyond the status quo and address each of the 3 components that are not working. The first thing we have to do is to accurately define the problem. It's easy to fall into the trap to thinking about, everything about the place that you live, your best restaurants, favorite places to grab coffee, and even the places to avoid at certain times of day because the traffic is really bad. I'm looking at you, 5 points. However, it could be that just because you know a lot about the place that you live, you actually don't know a lot about the community challenges that your hometown faces. We conflate our ability to describe with our ability to explain. I want to invite you to give yourself freedom from these preconceived notions and assumptions. This requires research, which means we have to do our homework. Now, when I moved to Athens in August of 2007, I noticed pretty quickly that there were 2 dominant narratives about our town. The first was that our main problem is poverty. And the second is that the main reason for this is that we're a college town, so the high concentration of low-income students was skewing the income distribution. Now, over the next decade, as a graduate student and then a faculty member, I heard these themes repeated time and time again in the classroom, community meetings, and even casual conversation. And for a long time, I believed it was true. Then in 2016, a collaboration was formed by the leading institutions in our community, championed by the Athens Area Community Foundation, called the Athens Wellbeing Project. And as the lead researcher on this project, I've worked with a team to collect a representative sample of household data on life in Athens that's being used to inform policy, and it is transforming our understanding of this community. With evidence from the Athens Wellbeing Project, we've been able to test that college town hypothesis. And what we found is that there's simply no support for it. We found something else too. While we have a lot of families living in poverty, especially in intergenerational poverty, we also have a high proportion of families who are very wealthy. The problem, as it turns out, needs to be reframed and redefined in a more meaningful way. This is not just a poverty story. This is an income inequality story. And this new insight gives us fresh knowledge on how we can move forward, and it breaks us out of using a tired, anecdotal narrative. The second thing that we have to do is collaborate. Through my efforts to help my family when my mom was sick, it became clear really early on that we were not going to survive this alone. We had to work with individuals and groups, some of who came to mind immediately, and some of whom I never expected. Immediate and extended family members, coworkers, friends, healthcare practitioners, but also people like social workers, lawyers, therapists of many different kinds, and even some complete strangers that were kind enough to lend a hand. Now, whether we're seeking to solve individual or collective problems, we often try to do this alone, but it shouldn't be our default. Instead, we need to figure out the individuals and agencies who are already working in a given area and engage with them. We need to become bridge builders, connecting points of strength in a community. Organizations, too, who are working in the same space need to view each other as partners, not competitors. And we also have to work towards cross-sector alignment, which means organizations that haven't typically worked together before across sectors need to come together to improve outcomes. This is happening across the country with the creation of community schools, where public school districts are partnering with healthcare systems and clinicians to deliver healthcare at school-based clinics to students and their families, and even other community members. When we invest in preventive health in this context, we see enormous return on that investment. Evidence from the WIC program, for example, a program that provides food assistance and some health care to low-income children, young children, shows us that for every dollar we invest in that program, we see a $27 return on that investment. When we partner with both likely and unlikely groups and individuals, we save time, we save money, and we improve client outcomes. Shared vision among collective partners, community partners, leads to more effective collective action. The third and final thing that we need to do is parallel process. Now, for someone who's battling a really serious illness, those acute emergency needs, the daily things are always on the forefront of your mind. Nutrition, medication, getting back and forth to treatment were some of those acute needs that my mom had when she was sick. But what we also learned is that we had to really think about long-term planning as well at the same time, especially around financial issues. We had to do both. We had to parallel process. Now, parallel processing means that we have to focus on multiple things at once. It means that while we're still doing that critical emergency work, that we also focus on long-term planning and invest in problem solving that really tries to get at the root of the things that we're facing. This is no easy lift, right? We're Americans, we love immediate gratification. We see this in the way that we eat our food, the way we consume our media, the way we elect our officials. And I'm going to be honest with you, I even see it in my marriage. Now, before I go any further with this story, I want to give the disclaimer that my wonderful husband is here tonight, and he has given me permission to share this. I love you, honey. So here it goes. My husband loves chicken wings, which means he has a lot of heartburn, which means we spend a fortune on Tums. So since we've gotten married, I've been trying to teach this man parallel processing and say, look, let's go ahead and get the Tums to treat the heartburn, but let's also think about not eating chicken wings so often, so in the long run, we don't even have to deal with that pesky heartburn. I love you, baby. When we pair our preference for immediate gratification together with emergency, serious need like hunger, it is no wonder that we often spend too much time focusing on what is urgent and not enough time focusing on what is important. And the emergency work being done is critical, of course, but we've also got to focus on some long-term problem solving. And one example I'd like to share with you is something that we're finding and trying to understand through the Athens Wellbeing Project data. Our recent data have shown that 1 in 3 residents in our county who need access to dental care cannot get it, largely due to reasons around affordability. Now, the usual approach for someone who's facing the need for dental care but doesn't have a dentist is to go to the emergency room where they're given pain meds, sent home, told to follow up with a dentist. But if you're a low-income patient and that's not an option for you, that leaves a significant gap in your health care, which can lead to serious short and long-term health problems. But we have an opportunity to address the root problem. Now that we understand this particular thing a little bit better, and we can think about the collaboration already going on in the community, we can look to the 2 clinics in town that we know have the infrastructure to help treat these patients. They've got the dental equipment and the chairs ready for patients, but we need to get dentists to volunteer their time in the same way that primary care physicians already do to treat low-income patients in our community. And if we can do this, we'll have made real, tangible progress. Now, I'm not pretending like this solves the problem. The problem is huge. It's way beyond the scope of what this one thing could do, but small wins like this deserve to be celebrated, acknowledged, and built upon, because that is how we change our community over time. That is how we move forward. So, how do we each begin to move beyond the status quo? It begins with a choice to participate, to see yourself as being empowered to initiate change. And as a change agent, it's your role, it's your responsibility to see the importance that you play in your community. It doesn't matter if you've lived here for a year or a lifetime. That is irrelevant. Once you choose to be engaged, then you can find a place to plug your unique skills, talents, and personality into the fabric of the place that you call home. Think about every series that you read or watched as a kid, any of the 3,000 superhero movies that have been released, okay? Captain Marvel's good. You should go see it. Even those heroes get help along the way. Now, you might not get a magic wand or the power to fly through the air, but there are real tools, resources, and helpers in place. There are excellent organizations who are doing meaningful work that are waiting to work with you. The ground rules for us are the same, no matter our position, level of experience, or history with community engagement. What we do have to do is to be willing to learn new things about people and places that we already think we know really well. We have to be willing to partner with those who we might not expect. And we have to keep doing that critical emergency work while we also look to the future and think about long-term solutions to the problems that are at the very bedrock of the things our community face. Now, my mom passed away 2 years ago following a long and courageous battle with cancer. And at the time, I was 21 weeks pregnant with my first child, my daughter Bonnie. And what I'm about to share with you is what I hope to teach her. The lessons I learned from fighting that disease with her taught me a lot about resilience, about how to not give up even when the odds are clearly not in your favor. Now I see how problem solving for individuals and communities are the same in a lot of ways. We do not have a cure for cancer, but that does not mean that we stop trying to find one, and we do not give up on a loved one when a diagnosis brings us to our knees. Like individuals, communities have problems that we don't yet have the answer to. Homelessness and the opioid epidemic, for example. But that does not mean that we give up or disengage. We have much to learn. We have much to do, but we do not have to go it alone. And the sooner that we dig in, the sooner that we build bridges to one another, the sooner we will have happier, healthier communities. Thank you.